Over 32,000 children in Niagara between the ages of 5 and 11 are not yet allowed to get a dose of a COVID vaccine. But if and when the time comes for Pfizer's approval, Dr. Mustafa Hirji says Niagara Public Health will be ready for the rollout.
We've mapped out lots of scenarios around, what would be the volumes that we would need to take in our clinics, depending on how much support there is from pharmacies, from primary care, and in order to get that full group of students vaccinated.
They've also been looking geographically at where these children live to set up clinics to get the shot.
We actually think that this could be a campaign that is on the order of, depending on the vaccine supplies there, 3 to 4 weeks, and we could actually get a first round done of all the children or who have parents who want them to be vaccinated.
But Dr. Hirji adds there is a foreseeable hiccup: availability.
The Pfizer vaccine is actually going to be a special pediatric reformulation of the vaccine. It's not going to be the same vaccine we currently have in freezers. And so once it's approved, we're going to need to get a hold of that vaccine.
Dr. Hirji says supply could be an issue at first, just like the province saw earlier this year as the United States received much of the initial doses that were distributed. Pfizer's shot for kids 5 to 11 is 1/3 of the dose that they're giving to the rest of the population. Meanwhile, Ontario's health minister was asked today about the possibility of making the shot mandatory for children in schools.
Well, we're going to take a look at anything that is going to protect people, including young people.
She highlighted the high vaccination rate among those aged 12 to 17, and Dr. Hirji says it's led to fewer cases within high schools. But as for the rest of the education sector,
overwhelmingly, almost 2/3 are associated with elementary schools.
And when it comes to severity of COVID in young kids,
amongst children, the chances of severe illness are much less. That being said, we do definitely have a handful of children who have been hospitalized with COVID-19.
It's just a matter of time before Pfizer's CEO says it will apply to the FDA for use of its vaccine in younger children in the U.S.
I think we are going to submit this data pretty soon. It's a question of days, not weeks.
But Pfizer Canada tells us that they can't provide a specific timeline for their submission to Health Canada, but say they have been working closely with them to provide the data that would help support the decision to make the vaccine available to school-aged children as early as possible.
Hamilton Public Health also tells CHCH News that while they await a final decision from regulators, the city and its healthcare partners continue to plan for the potential rollout. Toronto Public Health made a similar announcement this morning.